The origin of drug is versatile. It is obtained from many sources such as plants, animals, minerals, microbials, and synthetic and biotechnologically. Also, they are preparing the drugs.
As we have seen, pharmacology is the science which deals with the drugs and its interactions and actions. Where these drugs are coming from? What are all the sources of the drugs? The drugs are coming from the natural sources. What are all the natural sources? Plants, animals, microorganisms. Some of the drugs are the synthetic form. We are preparing it. Some will be the immunoglobulins, growth of hormones and something, and immunoglobulins. For example, immunoglobulins like a rabies bite. So the dog bite is more injury was there. The vaccine may not be effective, may not be able to cure that one. So you need immunoglobulins will be the best option than the vaccine. First is the plant source. Plant source, what all the drugs are getting? Atropine, morphine, quinine, digoxin. So these are all the drugs also coming from this. And animals, mainly they are taking insulins and heparin, gonadotropin, antitoxin, sera. They are taking it from the animals. And also magnesium sulfates, aluminum hydroxide, iron and sulfur, radioactive isotopes are also from that we are using as a form of a drug. Microorganisms, you know very well, penicillin. Penicillin is a broad spectrum antibiotics. This is the first, they even against first they have tested with this against syphilis and cephalosporin, tetracycline and other antibiotic, augmentin. Many antibiotics are, why they are binding out many antibiotics? Because because misuse of antibiotics, they may affect by the nosocomial infections or methicillin resistance. So you have to go for the higher level antibiotics. As I told you, immunoglobulins, growth hormones, and then the chronic gonadotropin from the urine from the pregnant woman. They are taking synthetic source, mainly omeprazole, H2 receptor antagonist. This is also obtained from some of the cells culture and obtained from the recombinant of the DNA technology. We are taking from the human insulin. So these are all the different form of the drugs we are getting from this. So how these drugs, what is called pharmacokinetics? Pharmacokinetics means this is the study of the absorption and distribution and metabolism and excretion of the drugs. Once you take the drugs, how it is getting absorbed. Either you can take any form, like a oral form, intrathecal or whatever it may be, how it is getting absorbed by the plasma and the site of action and tissue in the stores and metabolism. Finally, it is excreted. For example, if you take some of the drug is called like multivitamin, you are taking IV fluids or multivitamin tablet during the excretion, that will have some impact. What is the impact? Maybe the yellow color discoloration of the urine, you may see dark yellow color will be coming. So nothing to worry about. It is mainly absorption and excretion of the drug. So any drugs, whatever the form you are taking, it's getting absorbed and then it is getting metabolized and it is getting excreted. So as a nurses, we have to know what is the pharmacokinetic of the each drugs. That's very important. So how these drugs are, what are all the factors which is affecting the drug absorption? For example, the drug is absorbed. Some of the drugs, good absorbed, you need to combinations with another one. Another drugs will be helpful. Sometimes will be vascularity. How vascularity? For example, the child is having a fever. Doctor will tell it takes the child to put this one better. We will, if you take Saudi Arabia till 14 to 15 year, they will put suppositories for the fever patients. So if the 5-year-old child getting fever, if you are not giving the drugs immediately, the absorption is affected. The child may develop the febrile seizure. To prevent that high vascular area, if you are putting the there will be absorption will be far better. And disintegrate and dissolution time. How we do have disintegrated and dissolution. Area of vascularity of the absorption surface. For example, what is the area you are putting? So whether the mouth or sublingual will be or the rectal, what is the area? And the metabolism degrade with the GI tract. Also metabolism degrade in the GI tract. Example, nitroglycerin. Okay, metabolism degrade in this one, those we will be giving in a form of a sublingual when it is affecting. The size of the particles, if the so big one, it will be take time to absorb. So we will be giving to the suspension form, will be liquid form, will be better absorption than the big particle. Presence of food delayed, presence of food, it will delay absorption. Some people will take a poison and come. they will die if they are taking it in an empty stomach. What happened? Because the absorption is very high. When the food is there, absorption will be delaying. But some of the medications has to be taken after food. Some medications can be taken in before food. For example, H2 receptor antagonist, that and all ulcer drugs and all will be taken before food. Gastrointestinal mobility. What is mobility of the gastrointestinal? Peristaltic movement. So that is also gastric emptying these intestinal mobility. It may affect. Then the presence of mobility. Why gastrointestinal mobility will be very high? For example, the patient is having a diarrhea. Will you prefer the give suppositories? No, because gastrointestinal mobility is very high due to diarrhea and dysentery. We cannot suppose to administer. Those people can be administered through the IV and other route. Presence of other drugs. So one drug's absorption will be affected by the presence of the other drugs. Then the pH and ionization of the drugs also play a vital role, and lipid solubility of the drugs is very important, and the formation, how the pharmacists are preparing the drugs. So these are all the factors affecting the drugs. So in this class we have seen about what are all the sources where the drugs are coming from. What is called the pharmacokinetic? It is a process of the drug getting absorbed, metabolized and excrete is called this one. What are all the factors affecting? What are all the factors which is affecting the absorption of the drugs? Thank you.